of the most talked about major lifelines of our community was severely affected by Hurricane Dorian. On behalf of the Bahamas government, I am so pleased to present this episode that follows the story of the reconstruction of the Rand Memorial Hospital.
For us now, Dorian seems quite far away, but the memories are still fresh within us. We had experienced many storms, and no matter what those storms brought, we survived. We did our best, and thank God we did so also with Hurricane Dorian. But this experience was more traumatic than any hurricane that we had ever experienced in Grand Bahama and in the hospital. The winds howl and bang against us. The water comes. If there is a little water, we bail it out, we mop it out. But right at the beginning of the storm came a rush of water that came to us and stayed with us for the entire duration of our lockdown. Yes, we had to take care of ourselves, but our paramount goal was to make sure that every patient that we had with us survived at the time. It's still an emotional experience to live through. And today we are giving thanks because even though we're not in the hospital, we've come a long way. The contractors and project managers have been working diligently to deliver the hospital to us. If you can look behind me, you can see that we have actually moved some services into our kitchen cafeteria building. That means that building is now substantially completed enough for occupancy in terms of provision of the services for our patients, food services for our patients. For the kitchen cafeteria building, we still have to finish the cafeteria side of it, and that is about 90% completed. We've also had much work done to the main hospital section, that is the clinical corridors. The pharmacy area is much ready for occupancy, and that includes the pediatric area, the foyer area, the front entrance. When we look at the area, you can see that the front part is ready for paving. That will prepare the entrance for the arrival of our clients, and it will be quite different from our last setup. In this present setup that we have in place, our clients will be able to ride up straight to the front door in inclement weather and drop the patients off.
The intensive care unit now will have the capacity for individual individual beds for patient care as opposed to a Nightingale-style ward. Within each room, you will have the capacity to isolate a patient if there is a need to isolate a patient while they still need intensive care management, and also to dialyze a patient. Each of the rooms will have the capacity to individually dialyze a patient if the need ever arises. And then in addition to that, when patients are discharged from the ICU, they don't go directly to a ward. They, adjacent to the intensive care unit, there's also a step down, a 3-bedded step down unit, which is an improvement on the 2-bedded unit that we had before. And that will have similar capacity to the intensive care unit. Even though it's an open ward structure, it will still have the capacity for dialysis. So what we have with the new isolation facility is basically a 4-room facility with a 7-bed capacity. So not just COVID patients can be addressed, but also our patients like tuberculosis who also require isolation. Patients like that can also be addressed in a specific ward and not impact some of our regular patient ward or patient space as it did in the past. Another big part of our renovation is where we are presently, the operating room facility. And some of us may know this facility is being renovated back to its where it was when it was built in 2011, and that is a 4-room operating suite. And it allows us or gives us the opportunity, once we have the necessary bed capacity, to have quite a few visiting surgeons. And I think that is something that the island of Grand Bahama can benefit from.
For a number of years, like most Grand Bahama residents, I didn't have need to come to the hospital. And you hear and growing up about the RAN this or the RAN that, but my experience taught me to have a new appreciation for the RAN Memorial Hospital. And I'm sure my family feels the same way, because sometimes it's not when you don't appreciate something until you actually need it. And so with me, for a week at the end of July, I was here at the hospital. I had the COVID-19, and 2 other family members were here also. And I must give special shout out to the doctors, the nurses, the support staff, because their professionalism was very good. And I've been hospitalized in the UK before, and the level of care that I got from the doctors, nurses, and support staff here compared to the NHS in the UK, their professionalism is on par with that. Yeah, so it's quite encouraging to see the progress that the government is making of recent. They started off a bit slow, taking into account Hurricane Dorian and the time that it took to get up. But in the last, I would say, 6 months or so, I think most Grand Bahamian residents would be able to see the progress for themselves. And not just are we going to be back to where we were before Dorian, but when all of the works are finished, it's going to be better. And I understand anyone can drive around and they can see the work going on themselves. So I think they can be encouraged with that, knowing that the hospital will be able to adequately meet the healthcare needs of Grand Bahamians.
I mean, Grand Bahama, they're going to be proud of their new hospital. Doing all the construction, everything had to be removed out of the area. The spaces was totally empty. So all the wooden studs had to be replaced. All the flooring, the walls, all had to be replaced. And I mean, we built like a little stronger and better for the patients to patients now, each bed will be equipped with oxygen and med gas. Rooms, you'll have rooms with 2 beds, some with the main areas. You'll have like 9 beds in 2 of the dorm areas, and adequate spacing between beds for patients. The new 3-story complex for the hospital, that should be about 5 feet above street level in case of flooding. That water don't come in back into the hospital.
The renovations on the hospital is going quite well. As you can see today, we're looking up. Everything is about up. Our contractors, the workers are focusing on finishing the fire suppression. They're doing the electricals, they're doing the IT services and everything that will prepare us for move-in. We started out after Dorian, existing in tents. Today, all of our staff, they might be still close together. And when I say close together, I mean they are not in their various home work area. They are still rooming with other departments, but we all have roofs over our head. So again, we are thankful that we have had that experience and that we survived through it. That experience strengthened us. It allowed us to be able to improve our mitigation skills in terms of managing disasters. It also allowed us to improve our development and our building skills in order to build more reliable healthcare facilities that can face many weather conditions.
To date, the Rand Memorial Hospital is further along in renovation. Good health care is a right to our residents and guests, so we are proud of the progress of this project in becoming a state-of-the-art facility. Be sure to tune in to our next episode, which dives into the next project that made history. See you then.